guys, welcome to episode 97 of Tiny ADHD Superpower. Today's topic is on ADHD and OCD. So let's start. OCD, what is it? It's a suggested in its name. It's characterized by having obsession and or compulsions. Defining obsession includes recurrent, persistent thoughts, visions, and impulses that are experienced as intrusive and inappropriate, and which causes marked anxiety and distress to the OCD individual. Compulsion, however, can include repetitive behavior such as hand washing, ordering objects, checking the door locks, this and that. So repeating words silently as well, that individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly by their ethics. ADHD and OCD are among the most commonly diagnosed neuropsychiatric disorders. The two conditions, which have overlapping symptoms and are thought to share underlying deficits, also have substantial comorbidity rates. Despite this prevalence and documented overlap, ADHD is often missed in patients with OCD and vice versa, often due to symptom presentation and wrongful diagnosis. So yes, ADHD and OCD can occur together, and they share many commonalities. First, its prevalence. ADHD is common in people with OCD, with estimates ranging from 5.5% to 52% in adults and 25% in children. The symptoms of people with both ADHD and OCD may experience more disabling OCD symptoms, and OCD symptoms may appear earlier and be more severe. Next is neurobiology. Both disorders share similar genetic predispositions, impaired attention, and frontal lobe dysfunction such as executive functioning. The treatment, however, also is using stimulant therapy, such as for ADHD, but sometimes it can also make OCD symptoms worse with stimulant. The research is controversial. There are ones that says, yes, it does help. There are ones that says it doesn't. Co-occurring conditions. ADHD and OCD are often associated with anxiety, depression, anger, sleep problems, and gastrointestinal problems. Symptoms can fluctuate. Symptoms of one disorder may be dominant, but then the other disorder can take over. This is sometimes called a whack-a-mole effect. Funny term. However, the symptoms of ADHD and OCD, even though are similar, are rooted from different reasons with differentiation across different individuals. So, for example, OCD has difficult focusing. For ADHD is inattentiveness, but for OCD is intrusive thoughts. In terms of hyperactivity, ADHD is physically restlessness, and OCD, however, is mentally restlessness due to obsessive thoughts. Last one, impulsivity. ADHD are just naturally impulsive. That's how they are. However, OCD has the need to reduce anxiety due to these obsessions. So, the comorbidity of ADHD and OCD is much more common than generally thought. Most research has studied the prevalence of ADHD in patients with OCD rather than the inverse, with diagnosed rates mostly falling around 30%. Comorbid OCD and ADHD enhances the symptoms of each other. Through the presence of OCD may attend hyperactivity in some ADHD patients. OCD also has an earlier onset when ADHD is present. Research also reveals abnormal activity in certain regions of the brain for both ADHD and OCD. OCD is associated with increased activity in the frontal and striatal regions. However, ADHD is associated with decreased activity in the similar regions such as the frontal cortex. Genetically, dopaminergic genes are implicated in ADHD, while OCD is linked to serotonergic genes. So one is dopamine, the other one is serotonin. Family history studies showing that OCD ADHD association compared to an individual without ADHD, an individual with ADHD is more likely to have someone in their family with OCD. So there's actually, the source of this article actually has more detailed explanation of combined OCD and ADHD and how the diagnosis can be wrong due to the symptom similarities between ADHD and OCD. It's under the description, so please read it. It's very useful. Finally, while a strong understanding of similarities is helpful, the fundamental is a solid foundation on the innate differences between OCD and ADHD. Thank you, and see you at the next episode.